This is the Human Resources Committee, November 7th at 2 p.m. The copy of the Open Meetings Act is located at the entrance of room 903. And if we could quickly go around the room and introduce ourselves. Start with you.
Okay, Matt Overly, County HR.
Joe Lorenz, County Finance Director.
BJ Morgan, County Commissioner.
Mary Ann Borgeson, County Board.
Karen Butch, County HR.
Tom Wheeler, Sheriff.
Kim Dunning, Sheriff.
Diane Badiato, Assessor Register of Deeds.
Constance Meyerndorf, Douglas County Clerk's Office.
John Friend, Clerk of the District Court.
Don Klein, County Attorney. Claire Duda, County Board.
Martha Sammartine, County Labor Legislation. Patrick Bloomingdale, County Administrator.
Catherine Hall, County Administration.
Mark Foxwell, Corrections.
Amber Redmond, Corrections.
Wayne Lovett, Corrections.
Tracy Krause with Aon.
Michelle Winger, President of UWA.
Dave Aldrich, FOPA.
Dan Glazberg, FOPA.
Matt Lewis, FOPA.
Don Berkey, retired.
Whoa.
Chris Swing, Corrections.
Nancy Ward, Operating Engineer.
Lori Burmeister, Sheriff. Denise Reader, Douglas County Sheriff.
Brian Perzak, FOP2.
Denise O'Donnell, Local 1483.
Startle, IBW 1483.
I already know their assessment register of deeds office.
Do you want to introduce yourself since we already been around?
Oh, Jim Cavanaugh, County Board.
All right, very good. So we'll go ahead and get started. This is a review of our health insurance plan, and who is going to take that one?
Yeah. Tracy's got a presentation, and I will hand some out. We weren't expecting such a large crowd, so we may have to share if you don't mind.
Diane's making more.
Okay.
Tracy, do you want to sit up here?
Okay, I'll talk loud. Thank you.
Who's going to be presenting? Is she going to be
Yeah,
presenting?
Tracy will be.
If you don't mind, because we can't get you on camera if you don't.
You can take my
She
spot,
says
Tracy.
that's okay.
Sit in that spot.
Thank you.
You okay, Mark? Yeah. Okay, good. I know. Do we have it to put on the big screen?
Matt. He needs a copy.
Oh. And the more copies are coming.
Yeah, more copies
so-
are coming.
Oh, okay.
You have one.
Yeah,
Never
we'll
mind.
share with you. Okay, more copies are coming. All right, go ahead, Tracy.
So the first page is just a high-level enrollment update to show you that the total enrolled employees in your medical plan is 2,152. So those would be each individual employees that are enrolled. We broke it down for you by your plan. The 300 plan has 427, 600 plan active, 1,423, 600 PPO retiree, 251, and then those in the high deductible health plan that has an HSA with it are 51. The strategy was to reduce and eliminate the $300 plan. We're on track to have that done. We're only going to have about 90 employees by 2018 that's left in that $300 plan. They asked me to present a high-level overview of a fully insured plan versus self-funded. Currently, Douglas County is a self-funded plan. So if you were fully insured and in a traditional fully insured plan, Douglas County would pay a premium that would be set by a carrier, in this case Blue Cross Blue Shield of Nebraska. The premium rates are fixed for a year, and you pay the monthly premium based on the number of employees enrolled in the plan. So that would be the rate against 2,152. Blue Cross Blue Shield of Nebraska would collect the premium and pay you healthcare claims based on the benefits of the policy that you purchase. If the premium is in excess of the claims, Blue Cross Blue Shield of Nebraska keeps the reserve. So if you paid $1 million in premium, only paid out $500,000 in claims, Blue Cross Blue Shield of Nebraska keeps that $500,000. However, on the reverse side, if the claims exceed the premium, Douglas County has no requirement to pay any additional money until the renewal increase the following year when the premiums would go up. With a fully insured plan, however, you don't have any flexibility. So if you go back to being fully insured, Blue Cross Blue Shield of Nebraska and the state of Nebraska control who can be covered and what can be covered. So Douglas County wouldn't have any control over certain elements of your plan design. Another incident of a fully insured penalty would be something called the hitch tax. It's the health insurance tax. In 2018, it was 3.2% of the total premium. So even a fully insured group that was gonna get a 0% increase is gonna get a 3.2% increase, and that money goes to the government. So that was held off for a few years, but they reinstated it in 2018. Now, if we're self-funded, like we are, Douglas County pays a fixed cost. So we pay administration fees and a stop-loss premium to Blue Cross Blue Shield of Nebraska. We reinsure ourselves at $450,000. So that means as your self-funded plan, Douglas County pays up to $450,000 on anybody's claim. It's not until somebody's individual claims goes over $450,000 that Blue Cross Blue Shield of Nebraska starts paying. So the county's exposure on every one person in this room or anybody who's enrolled is $450,000. The fixed fees are set for a year, and we pay the fees monthly based on the number of employees. We're currently, for 1/1 of 18, in the second year of our contract with Blue Cross Blue Shield of Nebraska. They offered a set 3-year deal. Of course, we have a termination clause provision built in with a 60-day termination, so we're not locked into that 3 years, but they are locked into the rates that they gave us for the 3 years. Blue Cross Blue Shield of Nebraska then processes the medical and pharmacy claims, and then they request the funding from Douglas County. So those costs vary from month to month as employees' utilization change. So on January 1 of 2018, when your deductibles start over, right, Douglas County maybe asks for less money from Blue Cross because you are paying the first $600 of any bill, and then the Douglas County co-insurance picks up after that. So Douglas County is actually the responsible for the payment to the providers for the actual medical and pharmacy services. If there's low utilization, Douglas County would pay less, and in that situation, the money would stay in the Douglas County Reserve. The group, you also have somewhat complete flexibility other than federal mandates. So Douglas County as the plan sponsor decides who is covered and what is covered. And so why do you have a self-funded plan? So the flexibility of a self-funded plan helps Douglas County use our health benefit plans the way it was originally intended, to attract and retain the finest employees. So benefits can be customized to meet the needs of the employees and to satisfy the objectives that Douglas County has. Again, how do you save money? So in contrast to the fully insured plan, when the premium is kept by whoever the carrier is, in this situation, we're just paying the fixed fees, which are extremely low, and then the claims, the variable piece. So we always keep what's left over. So if you wanted to ask what type of funding is right for Douglas County, we can do an actuarial analysis using your current employee census, using your last few years of your claims experience, and one of our actuaries can create a report telling us if you're better off to be fully insured or self-funded. And so if that's something you would like to do, we can present those financials, but then also, if the Douglas County Board were to make a decision to move funding and change the funding vehicle back to fully insured, we would recommend that it goes to market. So I think on the prior board meeting, it was talked about Central States offers a fully insured plan. If Douglas County would decide to go fully insured, we'd like to take that to market and allow everybody to propose rates for a fully insured plan. It would not be common for a group your size to be fully insured, but we
Yeah,
can.
Tracy's in the rule of thumb that if you have like over 1,000 insured lives, so if you go to
Yep.
just about everybody is self-insured.
Yes.
Yeah.
I would say probably the largest group that we have in our book of business right now that is a fully insured group is 600 Lives, and it's
Yeah.
a car dealership in town, so they have complete turnover all the time. So then we wanted to talk about what our healthcare landscape looks like here in Douglas County. So Omaha and the surrounding area, where a majority of our employees live, we have two primary and competing hospital networks. CHI, which is Catholic Health Initiatives, includes Allegiant, Lakeside, and St. Elizabeth and Lincoln. And we also have NHN, the Nebraska Health Network. So that includes the Nebraska Medical Center, Methodist, and Fremont Health. And then there are some standalone hospital systems, so Children's stands alone, Boys Town stands alone, and Bryan stands alone in Lincoln. They asked me to talk a little bit about an accountable care organization, and that's that abbreviation ACO. High level, an accountable care organization shares risk with the employer group, but it should be someone who can provide care from A to Z. So one hospital system that could provide all of that care. In our area, in our landscape, we have CHI who's trying to build an ACO, and we have NHN who's also trying to build an ACO, but they can't really provide the services from A to Z. So for example, if Douglas County were to contract with CHI, but Mary Ann would need a lung transplant, I'm sure she'd want to have that lung transplant done at the Med Center, because that's what they specialize in. Or if we decided to go into an ACO arrangement with Nebraska Health Network, but we have a child of a dependent who has a rare form of cancer or some serious condition, we would want that child to be treated at Children's. And so for an accountable care organization to be fully functioning, it should be able to provide that care from A to Z. And here in our landscape, we just don't have a hospital system that can accommodate that. Like I said, we have variations of it. And like I said, if you got Ann Oason in the room, she would tell you that they've had successes and failures with their modified ACO because they have arrangements with the Boys Town and the Children's. And Lee Hankey from NHN would tell you the same, that they both have successes, but they both still have major challenges. So then, in talking about the healthcare landscape, we also wanted to talk about narrow network and what the three big players in our area can offer us. So what a narrow network would do, and I'll run through what is offered first. So Blue Cross Blue Shield of Nebraska allows the groups to choose from three options. Currently they have Network Blue, and that's every provider that they contract with. That's their broadest network. Then they have Premier Select Blue Choice, which excludes CHI providers. So that network was developed when Blue Cross Blue Shield of Nebraska and CHI were having their disagreement on pricing. So Blue Cross created a network that specifically excludes CHI. And so if a group wanted to opt into that, you were going to see different discounts than you would if you had the full network. So in the full network, the Med Center might give, on a $1 claim, they might give a 90-cent, give a 10% discount. If you picked one that excluded CHI, they might give a 30% discount because they know they're going to get the steerage, so the utilization is going to generate more revenue so they can afford to have a deeper discount. 1/1 of 18, Blue Cross has also negotiated a contract specifically with CHI. So that contract would then exclude all of the Nebraska Health Network providers, which would be NHN and the Fremont. So as an employer, you can decide which of those you want to be in. Aetna allows you to pick from two, okay? So they have the Nebraska Health Network and then the Catholic Health Initiative. They were the reverse, so Aetna negotiated with CHI first, versus Blue Cross negotiating with NHN first. And right now, United Healthcare does not have a commercial narrow network. So if Douglas County were to decide to go to a narrow network option, right, we'd have a lot of decisions to make, and we'll go over that on the next page. We'd have a lot of communication to do. But at the point in time, if we're with Blue Cross and the service isn't good, they're not paying the claims the way we want them to, and we wanted to move, we would essentially eliminate United Healthcare from the offering unless we wanted to go back to a broad network. So if you wanted to do a narrow network, here are some strategies, and it becomes really a multi-step process. So the first step would be to have your employees start to identify a primary care physician at open enrollment. This isn't a requirement. It's to start having your employees think about who do they go to for their primary care. who is your medical home? And I think the thing that you're going to find is a lot of employees don't have one, right? Women will typically be able to identify an OBGYN, but they do not have a primary care physician that they go to on a regular basis who would get to know them and they would get to know the provider. And so starting that is the first step in the awareness. Again, it's not like 15 years ago when you designated yourself a primary care physician and you had to go there before you could see a specialist. Okay, it's just starting that awareness that you have a primary care physician and that should be your medical home. And then this is also going to help provide Douglas County the information needed to analyze what narrow network option would work best for them. So by the employees identifying where they want to go, we could see if 90% of our people are already going to a Nebraska Health Network provider, that probably makes sense then to negotiate a narrow network that way and only have the 10% disruption versus just picking out of a hat and deciding one way or the other without knowing where our current employees are seeking medical care. So that's one of the first things we would suggest be done. Second would be to request reports that show where your employees are going. Because even if they're not identifying a primary care physician, they're still seeking services. So we would go back to United Healthcare and ask them to run a report since they were the administrator for prior years. We could go to Blue Cross Blue Shield of Nebraska and ask them to run a report, but we really only have 9 months of data through September. And then we could start analyzing where the people are actually going. And those reports have been requested. What we're trying to determine is if the carriers can drill down to the physician level, right? So there'd be hospital inpatient that they can tell us where our utilization is. And sometimes they can give us outpatient, but sometimes it's a little bit harder to get down to the actual physician. But we've requested the reports from both carriers. And then secondly would be to run financial reports that would help substantiate the utilization reports. CHI is going to say they have the best negotiated discount with Blue Cross, with Aetna, with United Healthcare. Nebraska Health Network is going to sit here and tell you they have the best negotiated discount with the 3 carriers. It wouldn't be until we ran reports that we could see. On a hospital level, what is the average discount that Blue Cross gives with NHN versus what United Healthcare does? Okay, so that's what we would do with that information. There's another little blip in the road here, which is, should Douglas County choose an administrator that could administer a direct contract with one of the networks? So right now, Blue Cross can't, United Healthcare can't, and Aetna cannot. Their systems can't say, if Douglas County went to CHI and said, we want to help and direct all of our care to you, will you give us a better discount than the one you currently give Blue Cross of Nebraska? They can't do the administration. So we would have to leave one of those big 3 and go to a smaller, what they refer to as third-party administrators, whose systems are more flexible and they could accommodate that. So the issue with that, though, is leaving the big 3 would force you into a smaller network which doesn't have as good of discounts as the United, Blue Cross, and Aetna. But again, Douglas County would be negotiating contracts with the provider. I believe that was brought up in a board meeting about a year ago with Sedgwick County, the arrangement that they're in. Currently, Sedgwick, I did a little bit of research. They're no longer with Coventry, so I'm not sure if they still have that direct contracting arrangement or not, because Coventry couldn't give me any more information because Sedgwick County is no longer insured by them. And then, should Douglas County not, you could offer multiple options too, to make it even more complex, right? Right now you have 3 plan designs. You could say, you could offer all 3 networks. So the premium for the broad network on the $600 plan would be $300. Then the premium with the Blue or the CHI plan would be $290. The premium with the NHN plan could be $270. So based off of the analysis we do on who has the better discounts, we would set the premium equivalents based off of those networks, and we would set the differential that way. But that does leave the choice on the table for the employees to decide. Do they want to have the broad network, or are they willing to make that change and go see only NHN providers or only CHI providers if they got a less premium to pay and could keep more money themselves. We have a lot of fully insured groups that go that route of offering the multiple options because they're smaller. It's easier administratively to manage.
Are there questions for Tracy on this, Don?
I have a question, just so if you say, we currently are on this narrow network.
Nope.
You can go to anybody you want. But if you went to that, so then the employees would have to say, okay, if it's just CHI, I can't have my knee replacement with Dr. Garvin at the med center because he's NHN.
He'd be out of network, so you'd have a much higher deductible and higher out-of-pocket
All right,
expense.
so that limits the choices that people would have
Yep.
tremendously, I would think.
And then the county would have to make somewhat of a political decision of, in our community that we support, who do we align with?
Right. That's what I thought you were saying. I just wanted to make sure that was.
Jim?
So now, as far as the employees goes, it doesn't make any difference if you're with Nebraska or CHI or Poison.
Nope.
When we changed over from United to Blue Cross, we heard a lot of people saying, Blue Cross isn't paying my XYZ prescription, doctor, whatever. If we're making that determination, not Blue Cross, why do we have that problem and still have that problem?
Well, I'm not aware of any current problems. You know, I will tell you that you had been with United Healthcare for, 15 years prior? And so I think that this was the first time that the plan actually got looked at, line by line, letter by letter, word for word. And so I think some of those things, if it got set up incorrectly with Blue Cross, once it was identified, we made the adjustment. The intention was and the intention is that the plans are identical. So-
Okay, well, yeah, there are still problems. I can identify problems that we've had in our family, just getting prescriptions filled. I don't wanna see a show of hands here, but I'm seeing heads nodding all around the room, and I constantly get emails. So maybe they're not making it to you or to you, but they're making it to me, and I'm experiencing it, and I think other people in this room are experiencing it. Should they be making it to you? Should you be aware of this, or is that not your job?
Well, pharmacy specifically would have, pharmacy would be a different issue than medical because pharmacies, the meds on the list change every quarter. And they changed every quarter with United Healthcare, or twice a year with United Healthcare. So if I was taking a drug with United Healthcare and they decided to make a change, I could no longer get that medication or I'd have to switch to something else. So we did make the move from United to Blue Cross and their formularies are very different. I mean, that's just, we looked at the analysis and they are. We did everything we could as far as member communication to identify those people who were gonna be impacted. We sent personalized letters to them. And I thought for the first while that all the issues were coming, being brought up, but I'd have to defer to Karen and Matt how employee relations go. If employees are having claims issues, they should be going to HR or, the people who have the right HIPAA authorization to get the claims issues resolved or get an answer to the employees.
Well, I know my insurance on meds is drastically reduced 50 to 75% on pharmacy wise.
So the meds you can take or the cost that you have?
The cost is drastically down.
Okay.
And it's a lot better because before it was $30 copay with United Health, for my blood pressure pills. Now it's $5.
And there were some cases of that, and when we did the analysis, there were going to be people who had lower, but unfortunately, there are also going to be people who were higher. But majority of people
Right.
saved in their copay
Especially
amounts.
since, they diagnosed me with COPD now, that, inhalers are only $30.
Mhm.
So, I love Blue Cross, on the pharmacy wise.
Okay, so the question I had then, if we do have difficulty, I was getting covered before and now I'm not, or dependent was and now they're not, same med, nothing has changed, then we bring it to you, is that right?
Yeah, we can absolutely help.
And that should not be a problem, right? I mean, if you were covered before, same meds, same thing,
Well,
you
if
should be
it's
covered.
on the same-
It would be if the
Formularies are
formulary
different.
is different, so,
Same
for
med might not
example,
be
I'll just use like the acid reflux. Yeah,
So Aspx was covered under United Healthcare, it's not covered under Blue Cross. Nexium wasn't covered under United Healthcare, and now it's covered under Blue Cross. So they're similar drugs to treat the same condition. If an individual, say for example, is prescribed a generic, and they don't want the generic and they want to get something else, then they can even have their doctor write a letter, and that's a possibility to still be covered. But when there's a difference in formulary between like Aspx and Nexium, you're gonna have to go with the drug that's in the Blue Cross Blue Shield formulary.
And that was a Douglas County decision as well.
'Cause
So
we
prior
could
to,
have done-
prior to moving with United Healthcare, we were on a very restricted formulary that we let United Healthcare decide, right? We're not pharmacists, we're not physicians, we don't know the best drugs to be on and off the list, so we left those decisions to United Healthcare. So when we moved to Blue Cross, that same applied. Blue Cross is pharmacy, they determine what's on and what's not. We would determine the co-payments, being the plan administrator, so the 15 or 30, whatever the co-payments are now.
Okay, so when we say complete flexibility at the bottom of page 3, Douglas County as the plan sponsor decides who is covered and what is covered. That's not literally true.
It is, you could choose not to be on the restricted pharmacy network.
You could go to an open formulary where every drug is
covered.
covered.
You'd watch your pharmacy costs
Costco.
increase, but you could make that decision, yes.
Here's an idea, and I don't know if we've ever considered this. We own our own pharmacy at Douglas County Health Center. We own it. And we could run all of our prescriptions through the Douglas County Health Center pharmacy instead of Walgreens or CHS or wherever we do it now. Have we ever considered that? Because other counties I've found who have health centers that own pharmacies have everybody go to their pharmacy and they have steep discounts on that.
We did look at that 10 years ago. And the problem with that is locations for employees. It wasn't efficient for those that lived in the western part, northwestern, whatever. And if I remember right, the cost was not that much greater.
Though, we're doing a better job of buying prescriptions now than we were 10 years ago.
Well, we're still using the.
And we can always look again. Yeah, it didn't go far last time we explored it, but we can check it out again.
We're always willing to look at stuff.
Sure.
We'd be more than happy to help with that too. I mean, you'd wanna look at, maybe Blue Cross's pharmacy being Prime Therapeutics isn't the lowest cost, right? Maybe Douglas County could direct contract with a CVS Caremark, or with an Optum, who's the PBM that United Healthcare uses, or with Express Scripts, they're a standalone independent PBM. So that analysis could be done as well to see where the best place for your pharmacy dollars to be spent.
We did that as well back then with the quote, at the time it was just the Walgreens, if you will. But, that was 10 years ago.
Yeah, and you go through a
Your idea
formulation.
could be a good one. Trying to do it at the health center, I think one of the things you're running into is timing and
Hours
how many
they're open.
employees you'd have to add
Middle of the night,
to
right?
take care of everybody, and I'm not an expert, but it seems like that could be a little overwhelming
Yeah, I
for their
think-
little operations.
I think the things that you would have to look at is parking, and you would have to look at staffing and space
Staffing,
for
for sure.
inventory, because you would be carrying a lot more.
And hours of operation.
And
They're
hours
open
of
the same hours
operations,
that employees
right, they're
are
not
working.
open, yeah.
Well, why don't we do this? Why don't we put that as a follow-up item to take it's a look at?
I like
Here
the
for where it
idea.
says we're not gonna get it taken care of today, but it's a look at issue.
And I like the idea of looking at the CVS, Walgreens, Kohl's, or whoever wants to, that's got a lot of locations to be, and you may give us better advice on that because of your expertise to say, no, I wouldn't, or whatever. But if you think that makes some sense, then we ought to start to discuss it.
In the analysis that we do, it'll show you the savings that can be achieved by each, and it's guaranteed savings.
Right.
So in the financial analysis, if it shows, if it's gonna save you $1 million, you'll get the million. I could come back with pharmacy statistics if you wanted to know numbers of employees getting scripts and numbers of scripts being filled. so you would know the
That'd be
volume.
helpful, yeah.
That'd be great,
And
and see
where
what
are
we,
they getting it? And
Yeah.
where are they getting it at? So they-
what we could save would be great.
Jim, were you done?
That's it, thanks.
Okay. Anybody else have questions?
Didn't you already do this in August?
Not
Put
for
out-
pharmacy.
You put out 3 pharmacy plan options that would save like 72,000, and then another one would save nearly 100.
Yeah,
Some of this was already done, right?
those were based on Blue Cross's
Cross's
network,
Oh,
and so we
right.
could potentially save more money by switching to a different provider of medications. And I think at the time, there wasn't really an appetite to exclude or have a disruption in that percentage of population for this small amount of money relative to the entire medical spend that we have in a year.
I don't think you wanna restrict pharmacy access, like you restrict the medications that are on that list, so that savings that you're talking about in August was eliminating pharmacies. So then, now telling Douglas County employees you can't go to CVS anymore because Blue Cross has struck a deal with Walgreens. So that's what those savings were. We're gonna show you a collective savings of same network, here's what each of those would cost.
Would it be smart to even do that as a supplement, to make it an option for employees?
No, it's gotta be all in or all out.
Any other questions or comments from anyone on this, topic?
So, let me get this. So you're talking about, going to the county to get your prescription, correct?
No,
We're gonna,
yes.
we're gonna explore that,
Explore.
Don.
It's not a given, it's just something somebody brought up that we look at.
Just an idea that
I
we're going to
just-
explore.
You know, people live far away to, you know, especially in the winter time, to go to a certain pharmacy.
That's our first feedback. We've gotten some feedback
Well,
already.
when we looked at that before, that was what one of the barriers
Yeah.
was.
I tend
So-
to totally agree with you.
But
The number
we'll
of
look at it
employees that
again.
take, the supply, I'm afraid, we haven't really seen complaints till we try to do it.
Otherwise, I would suggest that Walgreens at 171st and Center.
Yeah, right, real
Contract
convenient.
is just that.
I think the 96 one on 370 is perfect.
Sure.
Okay, all right. We don't, but every
Usually
idea
I'm a
is an
quiet
idea
person.
to take a look at, so.
Also,
we're
you
gonna
might,
take a
you
look
might
at it.
exhaust all your potential savings just in the staffing and expertise.
Okay.
So if we have a physician that, or a bill that's not being medical, not prescription related, but from the doctor or from previous insurance, it's not being covered the same way, I can bring that, I just bring those to you guys.
I'm happy,
You want the
absolutely.
statements and everything?
Yeah.
Yep, yeah, okay.
That would help a lot.
Anything else on this issue? All right, good, thank you. The next issue is salary for elected officials, and Karen,
Well, I have started, and I can hand out a copy of what they are gonna be for 2018.
I
You
have
have
that
that?
along
Good.
with the history,
Good.
cause I thought, I wasn't planning on reading the conversation,
Would it
but,
be good to put it up, or do we have our ability to?
I don't have it with me, but I
Oh,
can.
no, why not?
No, that's right.
we need to use that, Patrick, from now on,
Oh,
the TV, or the video.
Any more copies?
I can go back to scan it real quick and then we can put it up.
All right,
Let's talk about giving ourselves a raise. Oh, this'll go well.
So.
While we're waiting, and he's out of the room. Kathy there did a nice job for us. Matt is outstanding. I mean, he really, when you call or whatever, and I see you nodding your head,
Yeah, we've absolutely sent that same feedback over to Karen.
yeah, I just wanna say it, not trying to be nice to him, but I really mean it, he has been outstanding.
What I handed out was just, the last few years of increases, or the last few years of annual salaries for the elected officials, including the commissioners. And then we have two individuals whose,
He doesn't think.
oh,
I don't.
get a copy, can I still use
There's, it is coming, but we're just gonna start we're gonna put it up on the big screen.
Oh,
Here.
now let's look
Yeah.
at it, okay. So, and then there's two individuals whose salaries are set beyond, 2018, for 2019 and 2020. All the other elected official salaries are set for 2018, and my understanding is we need to get this done because, those of you that are running for reelection, you have to pay like a
1% filing fee.
thank you. So I know that this discussion, it needs to be done because it's timely. It has to be done fairly quickly and decided.
Do we need more
So-
copies of that?
Yes.
How many copies did you make?
I made
I
20,
know, but if
We can
you
find
want
December
to
1st.
25,
I
I think we need to,
Probably.
it's too much to
Yeah.
back up, I guess. Just go make copies, make 20 copies.
It's too much. So, I have to admit, I haven't really been involved in this process too much with elected officials, so I don't know what the process is, so, or if there is a process.
Well, we have to do, salary setting by a certain time, for elected officials, that's set. So what normally happens is, again, history is given, and then, a percentage is, provided for each of those positions as an increase. And again, I want to stress that we are setting salaries for the position, not a specific individual. So, that we have to be sure we're.
So like for the office, the
Right.
elected office. Okay, so I do know that, and when I was here in 2015, that was my first time with elected officials having some discussion. I do recall, and Don, maybe you can maybe not remember exactly as I do, but there was discussion about the public defender and the county attorneys. They try to keep those salaries the same. I don't know, but there was some discussion about that.
Yes,
Okay.
that's true.
Okay.
There's a statute about that.
Oh, there is.
Is there a
Okay.
statute?
There's a statute that says they have to be similar.
Similar,
Yeah.
not that they have to be exact.
Exactly the same.
That they have to
Okay.
be similar.
So outside of that, that exhausts pretty much my expertise.
That was it, huh?
So I can tell you,
So, go
I
ahead.
can tell you that the staff salaries, the chief deputy salaries, those have, are, are presented for consideration. So.
Who else at the table next got this? You got one? Anybody else?
So I think that most of the union contracts, are at somewhere between around 3% or 4%. So I don't know if that has a bearing on the elected official salaries of people that report to them. If there's any kind of compression with people that report to them. I think there's been some statements made to me by a couple of elected officials that their chief deputies are encroaching on their salary because of the increases given to the chief deputies, and the elected officials haven't come up with the same percentage rate.
Do we know
Or
who those are?
captains. I believe John Friend may be one. I don't, I did not look at the second in command salaries, but I can do that.
How close is yours, Joe?
92 or 3% of what I'm making. And then if you take the assistant chief deputy, of which I used to have 3, I have 1 now, that's compressions right there as well. So the 4% will help, and then that compression just goes to me.
Okay. So the 4% helps the chief deputy.
Assistant chief but if that's what they're
assistant chief
getting,
deputy
4%.
and the chief
And if the
deputy.
proposed 4% for her, I think we'll keep them all even. But with me at 2%, then it will compress.
Yes.
Karen, you said our public defender's not up this time, correct? You're
No.
just putting it there for purposes of the
Comparison,
overlap.
yes. And then the clerk's salary was also set in a different time frame, so there's a set as well, so through 2020.
So does any other elected official want to weigh in on their office's salary?
I have a
Wise man.
What's the traditional approach? Is it a survey that's done? Is it the will of the board? Is it recommendation from the elected official? How do you do that?
It's been a hodgepodge of many of those things. So we've used percentages of what we've given to the employees, or an average, if you will, kind of like this is what we're giving non-union, this is what we're giving union, and this is what we can look at for electeds. It's been, 1 year we did it off CPI, 1 year we did it where we looked at like counties, and what, if they had similar positions as ours, what they were getting paid. We do take a look at the state association does a salary, we're kind of excluded from that, if you will. So it's not really a good thing to look at, but we have looked at it. And then we've actually had the elected officials weigh in on what they think it should be. And sometimes it's a take of that, and sometimes it's a compromise of, well, how about, okay, you're saying 5, what if we give you 2.5? What if we give you 3? Not you, the position. So there's not a absolute set process other than this is the process here that we talk about it, and then what we look at is just whatever we wanna look at.
It's hard not to look at other counties within the state too. We look at all the comparables, all the information we have. With the exception of the sheriff and the county commissioners, each of our elected officials is the highest paid in the state for their respective position. But when you look at 75 to 80% of all homicides in the state of Nebraska occur in Douglas County, it is right that he should be the highest paid county attorney in the state. Nobody else can compare to that. Now, Sarpy County paid some of their lower attorneys a little more than I wish they would. But we do look at what other counties are as well. I'm sorry, I think there is one sheriff that's making more than Sheriff Denning somewhere, but by and large, most of our electeds are the highest paid in the state.
So if I remember the
Commissioner-
last time, I think what took place, and correct me if I'm wrong, anybody here that was there at those meetings, I believe Lee Leger put together a salary survey, and I think that what he used was a kind of a combination of what you said, some of the
Like,
somewhat comparable jurisdictions plus whatever's in the usual array that's usually used for negotiations. And then I came back, and I think you did too, came back with what we did a survey of our own, and came back and compared them, and then went from there. So I'm willing to do that.
Well, I'll be blunt. My thought would be if, as I look at this, if it's appropriate, I'd take the county attorney and give him 4%, and I'd take John Friend, the clerk of the district court, and do 4%, is what I'd do there.
Each year?
so we're setting it, that's the other thing, we're setting it for a 2-year cycle.
4 years.
4 years, sorry.
Except for commissioners.
4 years, 4 years.
Then it is too.
Well, I think it'd be good discussion, because I think that's a similar salary, and I also feel, you know, the county attorney does have more responsibility. Not that I'm any expert, but I think they're very similar, but at the same time, I'm thinking, to go to the 4% there is what I'd be doing for the 4 years. And if somebody wanted to say it should be 3 in the next 2 years or something, you know, we can have more discussion about it. I'd probably say on the assessor that maybe you do 2.5%. So I'll let somebody else do some more. I could do them all, but I think I'll yield.
This is, not a bidding war, I guess,
roll the
but,
dice.
couple of things, you know, we've got everybody here except the engineer, the public defender, and the treasurer. The public defender's not really on for this. Might make some sense to individually ask elected officials for their input on their particular compensation package. And to look at this in the broader scope, I'm not sure, Marcos, but how many collective bargaining units do we have getting 4% this year? And you don't have to answer right now, but, you know, that, it might be a compared to what kind of a situation.
It's all right.
The idea, I think, might be better served in kind of a, let's take a compensation view like we do at the end of the year with our non-union employees' compensation, which is a kind of a multi-year view I've had issues with, but I respect the process that we went through there, and see if we can get something that keeps everybody well compensated. We want to hang on to good people, we have good people, and at the same time, it doesn't create future anticipated problems. For instance, if we do 4% and 4% and 4% and 4% for the county attorney, we get back to the problem that we had 2 years ago when we had to do 14.7% for the public defender because they become out of job. And having talked to both the county attorney and the public defender, I'm sure that they'll, you know, accept 4%, but we're then setting ourselves up for 2 years from now, they're gonna be 4% apart like they were 2 years ago when we had to catch up and do a 14% for the public defender to get.
But they don't have to be the same, they have to be similar in the number of attorneys in one office compared to the other office.
Job.
Is substantially different. And I'm saying, hey, if it's 2% more for the county attorney, or 2.5% more, I think that is similar, looking at the responsibilities, and that's where I was coming from.
Yeah, I appreciate that. We're trying to hang on to good lawyers and good lawyers, okay? Lawyers pretty much do a lawyer's day's work, whether they're a county attorney or a public defender. You know, I think the public defender does a lawyer's day work and he does a good job for us, and the county attorney does a lawyer's day work and a good job for us. At that level, there's not a huge difference of lawyer's day work.
Well, and I know you have a greater expertise in lawyers, but I feel like if I'm managing 150 people and you're managing 95, I have a greater responsibility on that charge and responsibility. That's all I was,
And that
where I
may,
was
and that may
coming
be,
from.
I'm not arguing that, you know, I have great regard for Don and what he does, he does a great job for us, and his office does a great job.
Yeah, and
We moved
all of our
heaven and
people-
earth to get parity there 2 years ago when you look at that 14.7%. And if we just undo that right now, you know, we're gonna be moving heaven and earth in the foreseeable future to do that parity thing again. And I'm not saying that we won't do it, I'm just saying anticipate that that's gonna come if we do that. The idea that I express is, why don't we ask them? Why don't we get the input of the people who are actually doing these jobs?
Well, let me interrupt for a minute, because that's, today is talking two things. One, here are the elected offices that we have to set the salaries for. Here's the history that we have from 2014 on. Now, what we will decide is, what are we gonna look at to set those? And I think it worked best when we did look at other counties that were comparable, that we use in all of our other stuff to make decisions. And it's not that it's gonna be an apple to apple, it's gonna be here's what the comparables are for the counties that we use in our arrays for all different kinds of things. And let's take a look at that, and during that time is when we do provide, or we do ask for input from the current person who is in that position. Whether they agree or not agree, with what the comparables are showing. So, for instance, John, you look at the comparables that we would set on the table that we have brought forth, and you would say, well, yeah, that's all fine and dandy, except for I have this compression factor that's not added into what we're looking at on that piece of paper.
Or they're not the jury
Or they're
commission,
not
or they
there.
don't have a board of
Right.
mental health, or.
Right, so we would take all of that after we get that information and then start to look a little bit deeper into what that percentage would be as we move forward. So we would have data to make a decision.
And what's the date we have to have it done by, about December 12th or something?
Our
First.
last-
Before the end of the year.
Yeah.
I thought it was December first when you can go file.
I know, but they won't have.
So,
They
at
like
the
to
end of
approve it in
the last
December,
couple of years,
December
we've had the
21st of their last
non-union
meeting.
employees package come in, and those have been 4% to 4%. Are we anticipating something similar
You can
to
go
that
file,
proposal
right,
this
by
year?
December
Yeah, we're
first.
looking at increasing the range employees 4%, all the step employees 3%.
That's what the election commissioner told me.
1% of what, the first year?
You know, I think that and where our other collective bargaining units are coming in, if we're giving, you know, line employees 3% and 4% raises, well, you know, that leans me towards what you're talking about. I think everybody should be kind of, the high tide raises all ships. And we've moved the needle for these folks simply because there was a perceived disconnect between what they were getting over time and what our collective bargaining representative employees were getting over time. And so we stepped that up 8% over the last 2 years, and it sounds like another 4%, so 12% in 3 years for that class of employees. And that, you know, that factors into this, I think. It does for me anyhow, along with the comparables. And then what these folks who have to do the job have to say as well. I think all of those things would be a good package to give us some empirical data to go on.
Well, and one of the things to also remember but not get bogged down in total detail is that there's also a two-tiered, for some of the employees versus only one tier for other employees, so we would have to take that into consideration.
The step thing, you mean?
Okay, just a, just a comment of listening to everyone. I guess another option that we may want to look at is that I'm looking at the different offices, and I know the whole concept is that the decisions are made on the office itself and not on who's in, and that's very wise. But by creating disparity between the increases between the offices, that is sort of being done because every office holder and their responsibilities is unique to that office. And how can you say that one office's responsibility is any less important on a percentage basis than another office's responsibilities? So if the overall, the average for deputies, for example, was a 4%, well then, if we do a 4% for the elected offices, the office holders, then you're not creating more compression as you go forward. You're equalizing that 4% deputies, 4% elected officials, rather than go office by office and saying, well, I think this office should get a 2% and this office should get a 4%. That's saying something without saying it, because the responsibilities in every elected office are very critical to the whole of the county. Just my thought.
Okay, thank you, Don.
Very briefly, it's a little awkward, quite frankly, to be here, as running for re-election and talking about salaries. I'm very appreciative of the salary that I get right now and working for the county and with all of you. But I think, as Tim said, the way we've done this before is take a look at Des Moines and Kansas City and all these different places, comparables, and then take a look at those and then see where that comes to and make a decision about the office.
Right.
And that's what it's about, is just the office and the responsibility of that office.
Right.
So what I think we'll do is I'll work with HR and we'll get that information, put it into a good format, and then at our next HR meeting, we'll put it up there and have a discussion.
Perfect. Be good, thanks for your time.
So Marianne, when do you anticipate having this meeting again?
You have to file, they can start filing.
Friday, December 1st, we
Yeah.
have to be able to file and pay that 1%.
Within the next couple of weeks, we'll try to get the.
We'll have one more meeting.
We won't have
Well,
it
we don't
before
meet
December.
in,
You only meet the
We
21st
don't
of
meet
November.
next week.
We don't
it's
meet
21st.
huh?
Can we do it the 21st?
Yeah.
Well, that's
The
a
21st
short
would be-
time.
that's the only meeting.
Yeah,
I was
let's
gonna say
do the
the only day
21st.
we could do it is the 21st. We can have it by then. We should be able to get it. by
There's
then.
an administrative services meeting
At
on
1
that day.
o'clock
so-
at corrections, correct? So then you wanna do it
What's the correction meeting?
Administrative services.
at corrections of 1.
So we could just come back here at 2:30 and now
It wouldn't be
HR.
finalized before December.
2:30.
Yeah.
Is that a problem? Is it a problem if it's not
On the
finalized before
21st?
December
Yeah.
1st?
I
Might
think
be
you
Is
December
that gonna
fifth.
coincide, is that gonna conflict with his meeting?
No,
It'll be right after.
It'll be right after.
They told me what the 1% is, and I guess they come back and say.
2:30 on the
Say, they
21st
take
would
your
be our
money
next
and maybe they
HR
bill you
committee
later.
meeting. Okay,
Yeah.
here.
But that won't allow us to pass them in time. If they have to know by December 1st what the salary is, a committee meeting on the 21st won't hack it.
Well, I don't know,
That's
they
as
do have
soon
to-
as they can file.
But they can, I think they had to make a change once before.
We've done that.
Is that okay? If,
That
if,
is
I mean, if you, as
We've
long as you
approved
can
some.
I
file
think you
before
can-
January.
I think you can file December 1st and you write the check they tell you to write. And then
And you
if,
can, you
if
adjust
it's,
it.
if it's more later,
Then
they,
you pay more.
you pay
Right.
more later.
I think that happened.
Yeah.
We
Okay,
said
That happened
time
4
out,
years ago.
Time out, too many people talking at one time, time out. Clerk?
I'm basically just gonna say what John said, I know I filed before, we set the salary for 2017 to 2020, so. I'm not certain what the rule is, but I know I filed before it was set in December 2020.
John,
Just pay the difference.
did you wanna say something?
No.
Okay.
And then you have to pay the extra.
Right,
Right.
Fine,
okay.
then we're good.
Yep, alright. So the next discussion is on track bill, and this is Marcos. This was a, what? Am I skipping? Oh, legislative priorities, sorry, I'm trying to just move right along. Legislative priorities first.
Yeah. Want to pass one of those down? This one.
We have an audit committee meeting on 21st at 3, but I suggest we move that to a different.
Yeah.
Which is fine.
Now, just in way of introduction for this discussion, at our last HR committee meeting, we went through all legislation that was kind of, quote, a carryover from last legislative session that was just kind of still on the table, or one that we wanted to say, yes, we want to keep
Right.
pursuing it. It didn't go anywhere last year, so we want to keep trying. And in saying that, we really are trying to narrow, probably even a little bit further this year if possible, because it's a short session. So we know that big stuff probably isn't gonna go anywhere. Not to say that we can't talk about it, but we just know that being a short session, it's going to be more of a defense game than an offense game, if you will. So with that, Marcos, if you wanna run through what we currently have narrowed it down to.
Yes. So, as Commissioner was kind of, describing a little bit, we are now entering into a short session, so it's a 60-day session with the legislature. All bills that are active from the last session are still on the table, so essentially what we are doing is we're adding to the bills or legislative priorities that we've already taken a position on. So, and that'll carry us January 1 into the springtime. So, based on the discussions of the last committee, and now I'm working off of this item as the draft for discussion, November 2017. The standing items that we have had on the table, a bill, and these items, a bill has not been carried yet by one of the senators. It's listed there 1 through 4, and these are items that we share we currently share with the tri-counties. So either with both Lancaster and Sarpy, or one Sarpy, or with one or the other. So there are items on here, and just to go through them really quickly, to pretty much number one is mitigate the impact of LB 605. Lancaster has already submitted reimbursement from the state. I guess I call it reimbursement. It's assistance from the state based on the effects of LB 605. We also would like to pursue that, and that's one of the reasons why Dr. Foxall is here. That's a priority of ours. Number two is pretty much a general statement, but it's eliminating the underfunded and unfunded mandates on counties by the state. We currently pay the HHS office space, we pay probation office space. These were bills that were filed in the 104th. They did not make it onto the floor. So these kind of items, we would like to see compensation from the state, or something worked out with the state, that so many things are being passed down to the county level. Number three, counties to share in the automotive sales tax. We now get a flat fee. If Mr. Ewing was here, he would also, I think, tell us all that it's a significant decrease in revenue that the county receives. We pretty much receive the same flat rates for doing our job in collecting sales tax revenue as other counties do, although we account for 35 or more % of the volume. I mean, it's a huge amount. So that's number three on there. Number four, Greenbelt designation. This is something that the board has seen before many times. It really is cleaning up and more clearly defining what Greenbelt definition is in Chapter 77. And this is one that we share with Sarpy as well. New items on the table. Some of this was discussed at the Tri-County meeting that we had out in Lancaster last month. Number one is on there, supporting an effort to modernize the County Purchasing Act. This would just double the thresholds that we could have in the act. It would be very helpful. It hasn't been updated in years and years, so that would change Chapter 23. We anticipate some bill will be filed this session on it. Number two is opposing LB 510, and I have some copies based on the discussion of the last committee. LB 510 is restricting installment contracts by political subdivisions to $25 million. This has been filed by Senator Epke of Crete. It is still in committee. It was filed last session, still in committee. And essentially it would place a limit on the amount of debt political subdivisions can acquire in installment contracts. Lancaster has significant concern with this because they would already be beyond that $25 million max. So I can share copies of the bill is only one paragraph long. So, and I also included for commissioners the intent statement from Senator Epke, et cetera. So you may want to take a position on this to oppose. Lancaster is, again, this is one on here that we share with Lancaster. The third item on there, and please, Commissioner, stop me if you have questions or whoever else. Okay. Number three, the last one on there, it's opposing LB 570 from Senator Friesen out of Henderson, Nebraska. This, in 2019, would provide a property tax exemption for all tangible personal property. To us, every year, this is about a $7 million piece of revenue. So it would account for, Joe, that's right below 7% or something like that of the county's revenue. So it would be a significant decrease in revenue for the county. This bill is also in committee, filed last session, and so we anticipate that, I believe it's Sarpy and maybe Lancaster will take a position on it as well, but we believe that Sarpy is the one that brought it up at the Tri-County, and they have or will be taking a position on it as well.
So at this point, are there any questions or comments about what is on the sheet for standing items or new items? And if you, after you take this and you kind of peruse it a little bit and you want to add some input, don't hesitate to shoot an email or call me or let me know about those. I did have a conversation with Pete Festerson from the city, and Tim and Tom, I think I'm gonna ask you guys for your input on this. We were talking about behavioral health issues, two of the things that we talked about was maybe doing joint resolutions in supporting some type of behavioral health bills. And two of the two are a bill that would, if it was introduced, would be allowing medical health professionals to enact the protective custody just as long, now right now it's only law enforcement officials that can do that. And so I was wanting your input on that, if you think that's a good thing, bad thing. Go with it, don't go with it, it would help, not help.
On its face, I can't see why it would be a bad thing.
Okay. Alright.
This is equivalent to our EPC,
Yeah.
emergency protective.
Yeah, so right now, you're the only ones that can do it, what the discussion is, it might be beneficial for the mental health professionals to be able to do that, or medical professionals to be able to do that while in the ERs or wherever.
Baker Act
Authority.
Had to check,
What do you guys
had to
think?
check
Baker
the
Act
laws
authority.
I think, just like listening to, like you said, just kind of the face value of it, it's not a bad idea. They're in the process of, we just received a grant, the CIT board just received a grant for the mental health coordinator to kind of help with the training and that coordination and response between the professionals, law enforcement, corrections facilities and all that. So it's certainly something absolutely to explore, because, I mean, I think at the face value, it's probably a good idea, but maybe there's, some of that discussion may, something we're not thinking about, that we're not thinking about, it's just, not accepted. We do get calls from emergency rooms to go and do the EPCs, so maybe we can eliminate that, but, or it's included in part of that collaboration that, that we're working on already, so.
So the conversation that we had was basically if we would just do like like they would do a resolution, we would do a resolution on the same day that basically says if, or pursue legislation that would allow this. We don't know even if a senator would be willing to carry it yet, but we want to jointly do this, so that it's an issue that we're working on together. And so that's the purpose of it. The other mental health one was to support a bill that allows the protective custodies across state lines. So like right now, Iowa can put somebody in a custody over here, but we can't over there, put them into a hospital over there, is what my understanding is. You guys know about that?
If we do an EPC, we get the guidance from Lansing Health, and so they usually direct the facility that we transport to.
But we can't transport over to Iowa right now, is my understanding.
And that could be, it's been a long time since, because we used to transport to Lincoln and to Council Bluffs, but it hasn't occurred in a long time. I guess I didn't know.
Yeah, there was something that stopped unless a legislative initiative was, and so I know Iowa has passed that, they want to look at that. I don't know if it really hurts to look at it, there's model legislation out there that we could potentially, replicate if need be. So again, these are more just resolutions that say we want to, they would say, we want to jointly pursue these with the city of Omaha.
We just usually take them all to corrections anyway.
So I'll work with, and you guys will be involved with me on it when we get further into the discussion, but I'll work with the city to get what that wording is for the resolutions, and then those would be added to our list.
All right.
Jim?
One thing. Senator Craig had a bill in last year on turf that I think Senator McAllister has indicated he's gonna kind of rework. It's still in committee, but we had some interest in that from the point of view of
322.
Having Turk entertain automatic rehearings on appeal and some other items. well. So, I'm sure that you're in touch with McAllister going forward, but.
Yeah. Oh.
That's probably gonna be in the mix, some Turk thing.
Okay, did you have one?
No.
Okay. So we'll again add the two that I just talked about, that will become our, that will become our legislative, and again, it's rolling. It changes, but this will be what we provide as our package for this year, going forward. Okay? So that does take us to the discussion on truck bill.
Okay.
And so Marcos, he, Diane, and Sean Kelly and I sat in on a demonstration conversation, if you will, with Track Bill. And Marcos is gonna give us the rundown on that.
Yeah, okay, so TrackBill in a nutshell. TrackBill is a service that we can contract with. It is a legislative platform in which we can, essentially they have a platform that gathers any legislative action of legislative bodies throughout the United States, the federal level, our own unicameral, et cetera. They keep that up to date as a, kind of like a, if you would watch the Bloomberg ticker, this information is entered in or updated by the second, and we can interact off of this platform, that, as in we, the Sean Kelly, myself, the commissioners, we can use this platform to communicate about legislation, track legislation. It would automatically generate my list that I have in front of you here. It could give me up to the second information of what happened in a committee hearing. It does a variety of things, and so we, I guess, administration would like to present that to the board as a service that we could use, not unlike something like Westlaw or Lex. It's specifically geared toward legislation, and we're very impressed by it.
And it would be both the federal and the state level legislation.
If we have some information on who Trackville is, I'd be interested in seeing that. Do we have any idea what they charge?
Yes.
Yes, we do. So TrackBill has given me the annual subscription would be $299, so $3,000. That would give us 3 licenses. It would cover the Nebraska unicameral and all federal level legislation. TrackBill is a entity that they have an office in DC, and then they also have their office in Salt Lake. Is that right?
Remember it being Salt Lake. This was a vendor, if I can interrupt for a second.
Yeah.
A vendor that was at our NACO conference that services other counties across the country, and I just reached out to him to say, what are you about, what could you offer, and would it be beneficial for us to track them?
Could we also, this would also work for HR legislation, right? So that if there's, so.
Anything.
So then
Yeah, at the
Marcos
federal
could
level.
help keep us updated in our office too.
DC and St. Louis.
Yeah, absolutely.
Well, if you have 3 licenses, where's that gonna be?
So a license, what we anticipate is a license would be with Sean Kelly, a license would be registered to me, and then a separate license would be to the chair or whoever the chair wants to assign that license to. Not unlike Westlaw or LexisNexis or subscriptions like that, I guess.
Okay. So what I would like to do is to have them put together a more concrete proposal for us that we can look at the details on and decide to move forward, and we'll bring that back, we'll bring that in front of the county board.
Okay.
One thing on the license question, that's a good one. If we could have a license that would be county commissioner's license, so that we could all access it, that would be something that I would like to see. I can see the advantage of this, but.
We can ask them.
Yeah, we can ask. I know what I've been conveyed is that the license is pegged to an email address. to a single email address. So, I mean, I will be sharing, like through this platform, I will be sharing information with commissioners. So you will receive information from the platform. Yeah.
Yeah, that's something I'd like to,
Okay.
I'd like to see.
We can ask them.
Okay. Yeah.
Okay, great. The last thing, and this is another pretty exciting opportunity for us. So, just way of background why they're getting ready. Qualtrics was a company that, again, has been servicing some of our counties across the country. And they have quite the story, and I'll take some of your thunder so we can get rolling here.
I just hope I fit under the table. I'm 6'9".
I know,
so.
or one of our commissioners, you know, Chris,
Yeah,
he has
that's
that
right.
problem too. So this was a company that was started in the basement of a house with the father and their sons back in 2008. And it was really, if you take the words quality and you take the word metrics and you put them together, they're really trying to get data based on quality and measure it to determine what they want to do moving forward. And that could be from customer service satisfaction surveys, company internal employee surveys, and now they're getting into the government piece of it, where we're interested in both of those two pieces, but also in civic engagement pieces. So they came, they did a presentation to the commissioners, and then we did a presentation to department and elected officials, and then they followed up with some of those entities, or offices, and they're going to give us their follow-ups, if you will. And some of those people are here and they can chime in once Qualtrics is done giving their presentations. But I will let Qualtrics introduce themselves and then provide us with their update on the conversations they had with our staff.
Yeah, definitely. Yeah, thank you all. Hope you're having a good day here. Things just not a lot going on your plates, it seems like, but we're here to solve all of your problems. Sorry, I like to lighten the mood a little bit. I have a lot of, my name's Chase Winder. I have a lot of county blood in my family line. One of my cousins is a county councilwoman for Salt Lake County. My other cousin was the recently retired sheriff of Salt Lake County. So definitely understand county government boardrooms, committees quite a lot. So hopefully we're here to talk about some really interesting work about how to better understand the issues your county is looking to tackle, how to represent those, and how to ultimately close what we like to call an experience gap between you and your residents, you and your businesses, and you and your employees. So that ultimately you can have more effectiveness, efficiencies, and serve the taxpayers better, and really do more with less. So just a little bit about the team here. We have Connor Rowe with us. He's the account manager for the state of Nebraska. Good Midwestern boy, although he went to, he's from Ohio and is an Ohio State fan, so we're sorry about him. I like another team that's in red and white, not the Cornhuskers, but I went to the University of Utah. Myself, I'm the area manager, so I cover pretty much from Nebraska all the way through the Mountain West, and I work with a number of the largest counties in the region. Maricopa County is a large customer of mine. Pinellas County, Coconino County, Salt Lake County, Utah County, Arapahoe County, Colorado, and as the commissioner indicated, we are the standardized data collection and analysis platform by NACO. They've chosen us after an extensive vetting process because of our ability to really help tackle a lot of complex problems facing county government. And we're now working across the country in some of the largest counties, including Miami-Dade, LA County, Riverside County, Mecklenburg, Cobb, Fuller, kind of you name it. And we were very honored to have the LUC conference actually hosted in our office in Provo, Utah. And classic tech startup story, but it's pretty fun. The office is just your typical, tech campus. We've got dogs and skateboards and scooters, basketball, and seeing as we're from Utah, we always come out 2x2. So we're happy to be here. But We spent a lot of time here in the county, and we're really excited to kind of show back to you our discussions that we've had with corrections, the discussions we've had with the youth center, the discussions we've had with health, with the PIO, and a number of different areas. So, kind of introduce a little bit of our team already. Also wanted to just highlight that we are on the statewide contract here for purchasing in the state of Nebraska through the former WISCA NASPO and now the NASPO Value Point contract, U.S. Communities or GSA. So Lancaster is actually finalizing their contract with us on the 9th of November. So just a couple days from now, we're kicking off our work with Lancaster, and we'll be meeting with Dan and his team down in Sarpy on Thursday as well, who are also looking to get started with us. A little bit more about the details of Qualtrics, and I know this is maybe a little redundant for a few of you, I apologize, but just to get everyone up to speed. We are the world's largest citizen insight cloud across the world. We employ about 1,500 people. We're a $2.5 billion company that will be going public next year. And currently we serve about 2 million users across 90 different countries and 100 of the top 100 business schools and 10,000 organizations. In the private sector, we are really the go-to brand. We have 2/3 of the Fortune 500 are using us enterprise-wide. We just signed an enterprise-wide deal with Walmart, with Honda, with USAA Credit Union. My favorite story here is actually to highlight JetBlue. And I think government's a little bit guilty of this at times too, but they were having a big problem with some of their customers out of their Boston airport to San Francisco, and they couldn't understand why. So they hired a bunch of consultants to go out and study it. Spent a lot of money and came back and still weren't quite sure. But Qualtrics has developed a technology and a platform for you to not have a one-to-many conversation with your residents and your businesses and your employees, but a one-to-one conversation with the key stakeholders. And what they did is they started interacting with all of their customers through mobile phones, text message, apps, whatever channel works for people, we can cover it. From the youngest, hippest millennials to, even our older demographics. People like my parents, I'm trying to get to text now. It's exciting work. But what happened is that what they found out through the Qualtrics process is that, and I kind of like this story because it's a funny anecdote, the flight left at 5:30 a.m., but the coffee, juice, and bagel places didn't open until 6 a.m. So you had hungry, uncaffeinated East Coasters boarding a 5-hour-long flight from Boston to San Francisco on an early morning flight. What they did with that data is equally as important as getting the data to begin with. They decided to get a coffee cart, a juice cart, and a bagel trolley and hand them out for free. They charge $2 more per ticket, passed along the cost. But that's not what's important. What's important was the results and the ROI. They grew the revenue from that one action on that one route $98 million a year in extra revenue. They speak at every conference for us. They're all over our homepage. And their CEO attributes it to what we like to call closing the experience gap. It's one thing to deliver services, and it's another to understand what the customer experiences as those services are delivered. And so we worked to close that gap, and it translated into revenue, efficiencies, better positive word of mouth, and engagement for them, and a very happy customer. Here across Nebraska, we're no stranger to our public sector friends and customers across the state. We have tens of thousands of students right now coming out of college all across the state that are using this product in the classroom. OPS, Lincoln Public Schools. Department of Education is actually, we're not the education reps, by the way, but our education team is here right now expanding their account with Department of Education, who really love and appreciate our services. We just met with the State Corrections Office this morning down in Lincoln, Connor and I, and one of their new hires had been using the Qualtrics platform in her grad program at University of Nebraska-Lincoln. So really across the state, something that a lot of people are familiar with this product and all very happy customers. Federally as well, with our counterparts there across many of the different departments, we're now up to 14 cabinet-level customers across the federal government. Healthcare.gov, NIH, CDC, Homeland Security, Postal Service, Air Force, and that list kind of goes on and on. What we really do is called XM. It's an experience management platform, and I'm going to go through these a little bit quicker than I normally do so we can actually get to the feedback we've had in the dialogue with your departments here. The first of which starts with surveying. A lot of counties, particularly here in talking with your commission and colleagues, are facing a lot of large-scale issues: mental health, homelessness, opioid epidemics, growth, economic development. How do you kind of tackle these issues? And to us, surveying really is about the macro level research. How do you understand the landscape? How do you build engagement with your residents? And how do you really provide this in a way that actually makes sense? And our platform provides for a lot of really good enterprise-wide governance and security and reliability. We are just now finishing our certification for FedRAMP, which is the highest level security for information and data privacy, which actually allows us and enables us to sell to the Department of Defense accounts federally. One thing that's kind of interesting is forms. Not everyone thinks about this, but throughout the departments and throughout your users and staff across the county, the ability to quickly and easily create a form, a sign-up, a permit, a registration, and get that out the door to the end user is something that can really help in that regard. The next is observations. We have an offline application mode for cellular devices, smartphones, tablets that allows you to collect data in person, face-to-face, and really get out and understand the community. A great example of this is the Utah County Health Department. They're a little bit bigger in terms of population than Douglas here, but very similar, a little bit of rural, a little bit of urban. They just did a health assessment where they went door to door with some volunteers and were able to collect that data in person on a smartphone, upload it to their account, and analyze it for alcoholism factors, opioid epidemic factors, and understanding what the needs are of the community and how to better market those. The next is assessments and evaluations. There is so many programs and services you provide. Federal mandates for reporting, state mandates for reporting. And a lot of times this process can be quite hodgepodge, right? It can be some paper data entry, it can be Excel sheets, it can be Word docs, and really being able to have one standardized platform to collect data, report on data, and get done the work that needs to get done quickly and effectively. So whether this is epidemiology, Maricopa County Health Department does a lot of epidemiology studies, particularly with some of the Zika outbreaks happening. They're trying to identify in the community where these are, how they're happening, and what our CEO likes to call listening posts throughout the community. How do you have an apparatus to make it a bit easier for residents to contact you? And having grown up in Salt Lake County with family that's elected officials there, I can tell you a lot of times board meetings and commission meetings, and you don't need to hear it from me, are not very representative of the general population. A lot of places like to call them the frequent flyers, the same 10 people, different names, Fabulous Five, for the very loud, vocal minority of residents and businesses on topics. And what we're trying to do is make it easier through mobile phones, internet, to allow people to access and be heard throughout the community in what we call a silent majority. Because they don't necessarily do not want to participate in government. It's often inconvenient, too time-consuming, or difficult. But if we can reduce and boil it down to engaging them with a text message and some forms that are easy and convenient for them, we're seeing a great amount of engagement, civic engagement, and data collection. Then what do we do with this data, right? I mean, that's kind of the question is, we're not just trying to collect data for data's sake, but one, we want to collect data to better understand it, and two, we want to create actions and ticketing from it. So one of the things that Miami-Dade County is doing in the handout that was going along is they've using this tool for a virtual 311 program with us. Whereas residents go to their website, go to their cell phones, go to their apps, and they have a problem with bulk waste removal or with the hurricane relief efforts, as we talked with the commissioner down there. We actually saw a picture of her dog and her at dinner riding out the hurricane in a county van. It was kind of a sight. But what we're able to do is take in the data and actually route it to the appropriate service around the county automatically. I'm talking right now with Mayor McAdams of Salt Lake County, who hosted the LUC conference, and they said they're wasting thousands of hours of FTE and staff time transferring calls back and forth between different departments when residents are angry and calling in. So this system efficiently notifies the right person to take action on an item. And statistically, we know through validated analysis that it's meaningful and impactful. And we can also understand at scale what people are saying. If we ask an open-ended question, how could we better represent you? And they reply, through our text analytics, we can actually break down all of those comments and automatically report on the topics and trends that are happening. Digitally, your website is a key asset in helping reduce what we call downstream complaints and issues. So obviously, if a resident business and employee goes to the website, can't find what they're looking for, that too can cost staff time, resources, and energy to getting them to the right place. So we have a lot of ability to create interactive content on the website to better understand the experience accessing your digital assets and helping to make that more effective. Internally, and I know Karen just told us you guys have been talking with your HR committee here about employee, it sounds like some compensation issues and other things. This is a great platform to understand the employee experience. We're seeing a tremendous amount of ability in increasing retention and engagement, which also help the bottom line. I mean, there's statistics, and I have a couple later in the slides that show just how much more productivity you get, less sick days you get, healthier workforce you get, and the ability to have more output you get with an engaged workforce. And it's not something you solve overnight, but we have a proven program and a process to do this across very large organizations and enterprises. And then finally, your customers. With all the services the county provides, whether it's corrections, youth center, public works, you name it, there's an end outcome and goal that you help provide services in a quick, friendly, and taxpayer-friendly way to your residents that help grow the community and produce positive outcomes. So this is the ability to track the feedback and inputs on those particular services, on those that you're helping, whether it's, coming out of corrections and back into the community, whether it's, a particular resident having a constituent relations issue with the commission or elected officials. The ability to kind of really understand and be able to provide feedback and analysis for those services. The next section I want to go into the use cases. Obviously, I know we have some representatives from the departments here that can talk on those, but I know I kind of threw this at you really quick because I wanted to get into what we've actually learned from your county and departments, but any questions here, comments on the full breadth of services offered before we jump into a department by department snapshot?
When you had said something about, the county used as examples, that they were wasting a lot of time, people with phone calls.
Yeah, Salt Lake County.
So what are you guys doing that makes it, whatever, one call, they know where to go, or, phone call goes exactly where it needs to go?
Yeah, definitely, and I think we can get you that booklet somewhere here, but it has the use case from Miami-Dade of their virtual 311 program. So essentially, what it is they go to the website, and there's just a drop-down menu of, for lack of a better word, complaints. What do you need help with? Is it public works? Is it waste? Is it animal control? Is it health? You click on that, and now there's a new subset of options. So you click through in kind of a personalized manner till there's actually a comment box, which you can then produce a comment. So one of the issues when we were working with Sally and one of the commissioners there was obviously a bulk waste removal following Hurricane Irma. So people could actually go to the website, they could actually click on that individual issue they were having, and then we have a ticketing and case management system that will actually route that scheduled request to the individual person so that they can actually receive that service and that follow-up. But it doesn't just say, okay, staff, here's a person to follow up with. It actually creates a ticket so that supervisors can monitor the responsiveness and time to responding to that request. And then it will also automatically send a follow-up customer satisfaction survey to that resident. You know, hey, you said you had a bulk waste removal problem following the hurricane. Did we do this in a timely manner? And are you happy with this service 1 through 10? So not only can the resident actually self-select the type of service and response they're needing, but they're also a part of providing feedback on how that service was delivered and the timeliness and satisfaction of that service being delivered. And so it's just through basically any web browser, text, messaging, mobile app, website, mobile phone, desktop, computer. It just all routes to one common link that the resident clicks on and fills out a ticket online.
That you said Salt Lake County?
Miami-Dade implemented it. Salt Lake County actually is voting on it next week in their council.
Okay.
To do the same thing.
Okay.
So, and I think if you go one page back too, there's a little diagram on the kind of we call it closing the loop process.
Okay. Thank you.
Yeah, thank you. Any other quick questions on this section? Okay, so I think maybe without further ado, I don't know, Commissioner, if you want staff or departments, or Mark, if you want to jump in and kind of run through these. But these are just kind of very high-level use cases and visiting with the departments that we've kind of identified. So I don't know if you want me to turn the time over to you, Mark. And
no, we've seen this presentation a couple of times, and the second time we had the individual presentation, it gave us a chance to kind of digest what opportunities were there for us, and we, staff and I talked about a lot of different uses, and going a little bit out of order. One of the biggest uses we see is with the reentry services. As you know, we book a lot of people, and we've got a lot of ins and outs, and it's hard to capture how well they've done after having received some type of intervention in the facility. But if we could track how well they've done before they come back in, hopefully they don't come back in, then we can adjust on the fly. So we really like this opportunity for the reentry services. Pre-intake assessment would be very helpful as we try to prepare for pre-release planning. I've already talked about the post-release assessment for the sentenced people, and even for the folks that go down to the pen that take advantage of the interventions that we offer in the food survey. You know, one of the biggest potential problems is if food's no good, then you have unrest amongst the inmate population. Right now we do surveys kind of they're hit and miss, and as we do our rounds through the housing units, we ask about the food, the quality, the rotation of the menu, and whether it's hot or not coming up. This would really help us with that, and we could adjust on the fly to the contract for food services out. The recidivism piece ties into the post-release assessment. If we know how good we're doing on the post-release assessment, then we can take a bigger bite out of the recidivism issue, particularly now that we have the reentry specialists lined up, collecting data, actually staying on those housing units 4, 5, 6 hours a day. This would really be an opportunity for us to make adjustments in real time. Tracking the social services post-release, I think that is important for us because there's a lot of providers out there, some pretty good, some not so good, some enthusiastic, some not so enthusiastic. Again, that ties back in to the post-release and the volunteers coming in. I think, and we're going into a new jail management platform that's going to be more friendly than the mainframe. So the interface is going to be a lot, provide more opportunities for us than what the mainframe does right now. So I'm very supportive of it right now. I think it could really improve our operations. So it's got the support of our staff.
That's great. Thank you. Any questions involved there? All right, we'll go to the youth center use case, which I think was actually, for the most part, very similar to yours as well. One unique caveat was with the teacher and obviously education down there is because we work with OPS, Department of Education, we have a lot of good education assessments. So credit deficiencies, credit recovery, ability to understand the educational pathway and tracking of those students and their IGPs and individual graduation plans. So I think that was another thing that was very effective there. One thing that Lancaster Human Services is going to be using us for is texting the youth their court dates. As my parents know, the best way to get a hold of me, particularly when I'm in trouble, is to text me. So I think the same premise applies, that particularly with our millennials, which I am one, I'm sorry, but we text, so it's a great way to get a hold of us. And not only a great way to get a hold of us, but you can also text out assessments as well, which I think even for Mark's population, it very much applies to post-release assessment, that if you can text someone that's re-entered society 6 months from now and say, how did your social services go? Do you have a job? Are you employed? Are you doing these factors? Get that data back in real time can really help you adjust course quickly.
You know, we talked about pretrial population and court dates, failure to appears, and we're talking about, I was talking about postcards and they laughed at me. Millennials laughed at me.
I know.
No millennial read mail anymore, but if we could use, and you said that we should utilize that platform to get these notifications out for court dates, hearing dates, and maybe cut that FTA.
Yep.
I'm sorry, I'm gonna say one more thing.
Please.
Employee assessment, our attrition.
Yep.
Because of the millennials is very high. And trying to get a handle on why they're going to Cox Communication or why they're going to the sheriff's office and the police department. I get that, but it's hard to retain this generation. So trying to get inside their head and see, okay, what would keep you here? And I think this, we talked about that too, would be a real opportunity for us if we could get our hands around that.
Definitely. Yeah, that's a great use and very easy out of the box. So for that, but
The dollar sign.
yeah, right.
All about it.
Talking with Leah and PIO, and I think this use case applies to all the electeds here, and not only here in the room, but obviously countywide and citywide. How do you understand your constituents, and how do you understand them at scale? I mean, like I said, I've been around enough in my life to know that most of the time, I bet you're hearing from, you know the names of the people that are on your case. And a lot of times you're just not going to hear from those that, one, think you're doing a good job, or two, maybe have a more rational view of things. So how do we have a tool that can extend out into the community to listen and to be heard? And not only for the sake of taking action, but two, from the sake of building goodwill and a good brand. We talk about him a lot, but the mayor of Provo is going to win election today to replace Congressman Chaffetz in a special election in Provo in Utah's 3rd Congressional District. For 8 years now, he's had a 94% approval rating citywide, city of about 130,000 people. And he's known as the Provo Pulse Mayor. He sends out regular pulse surveys to residents that he's actually built his own resident panel of his population who have opted into a survey-taking program. So over 8 years later, he's had 75,000 individuals, residents in the community, opt into the Provo panel. And then they can pulse them on key topics. And what's great about the Provo panel is that as residents take surveys, it's dynamic enough to add that to their profile. So it comes in handy later on. And I'll give an example is they had a debate of raising a tax for solar panel installation on homes in the community. They call it the Fab Five. It's like the 5 angry residents at every council meeting. And they felt like they just couldn't come to a consensus in the council meeting, tabled it, said, let's go to the Provo Pulse, let's collect a little bit more feedback on this topic. They then went into their panel of their 75,000 residents, and they filtered by homeowners. We have Brigham Young University there, we have the Missionary Training Center there, we have a lot of renters, a lot of young population, not homeowners. Don't apply to this tax policy question. So they filtered for a list of homeowners, they put in the content, what was being debated, the pros and cons, I mean much like a ballot initiative, and they emailed it out to these residents that had opted into this process. They were expecting to provide feedback. And they had 3,000 residents respond in 12 hours on this topic. And it was just really impactful to the policy, and they actually came to consensus. They worked out the resolution and they got it done. And so, but this not only helped them make a decision as representative officials, but it also built goodwill to the residents that they may not have all liked the decision, but they all liked participating in the process. Another great example is Salt Lake City. We talked all LUC conference long on homelessness. And Salt Lake City just got the platform 2 months ago. They actually have all their residents' email addresses from they have an all online utility billing system. I live in Salt Lake, so I'm part of it. They just uploaded their utility billing system into their panel, shot out an email, and on their first homelessness topic, they had 5,000 residents reply to their homelessness survey, understanding issues, problems, and it was more of a fact-finding one. It wasn't really policy questions, it was more fact-finding, but they said the PIO there told me in one project they'd broken all previous engagement records in the history of the city. So this is a very proven process, and it's one that residents appreciate. It's one that you can actually brand. Every customer we have brands their Pulse panel program some way. I have a city of Kaysville. They call it the Kaysville Connect with a K, right? And I actually used to be a PIO for an Air Force general in Virginia in 2012, and I have more of a PIO hat on than other use cases we're describing, but it's something marketable to the people. You can put it in their newsletter, you can put it in their utility bills, you can put it a notification that says, we are Douglas County, we care, we want to hear from you, would you like to participate in this ongoing program? And then what's awesome is as you have use cases come up, maybe you want to build a new mental health facility, maybe you build a new corrections facility years from now, you now have a engaged panel of residents that are expecting to hear from you. And when you have that, you can filter, you can create samples, you can create representative samples, you can do tribal data, you can do lots of things, and we have a whole program process. We employ 35 PhDs on our staff that will help you with all these use cases. But to me, this is the utmost, important process for engaging your employees, engaging your residents, and your businesses. I can't stress this enough. We do a lot of economic development. Your businesses have needs just like your residents, just like your employees. And it's of utmost importance to understand first what those are, build a relationship, and then use the data to make better decisions. Health department, got 2 more use cases here from your team. Talked with Dr. Poor at length about what they want to do. They want to become more than just the department of when things go really wrong with Ebola and with Zika and with everything else. They offer a range of services, so they're very interested in using this product to understand what is their brand out there in the community. Is it we only go there if we're terminally ill with some unknown disease? Do we go there for obesity initiatives? Do we go there for child resources, clinics? What is it, and how do we better market our services out there in the community? And so they really want to use the panel program, they want to use the community engagement, and they want to be able to understand their needs, what services to offer, and really how to better serve people in the community. Last but not least, obviously, this was the HR committee talking today. We just did a product demo Thursday with Karen. Yep. Exactly, and have really kind of dug through things. So I don't know if you want to jump in here and talk a little bit about what you've learned so far and the use cases.
We haven't really been able to do an employee engagement survey before. The county just hasn't done one, and I think, as Mark pointed out, it's a good time for us to start looking at doing it, and Qualtrics offers a really solid platform to be able to do that from, including, as he said, the offline with the smartphone use and so on. And we have a lot of employees. They may not have access to their a computer on a day-to-day basis, but they all have smartphones. Most everybody has a smartphone. Whether they're a dietary food service worker, a laborer in the engineers department, or a corrections officer, they have access, and it would be really good for us to have an understanding of by department, and there's all kinds of ways that we can filter data through Qualtrics to provide us with some really valuable reporting and basis for information on efforts that could be done at a departmental level or through the county overall. It does integrate with Oracle, which would be really nice. In fact, we can even integrate it to the point where we can filter or weight based upon an employee's performance, so that you can take into account the feedback from individuals who are maybe more highly engaged or more accountable or higher performers over those. Because just like you have the fabulous 5 that are citizens, we have the same thing with employees. Those that are often the loudest may not represent the comments of the majority, and generally don't. Also, the other part of it that we were really excited about was attrition and retention and being able to do exit surveys. Right now, we do an exit interview, but it's a paper questionnaire. We send it out to every single person that leaves. We have less than a 1% return rate. It's horrible. And so this will probably, I really believe that this could help us in being able to identify issues in departments, as Mark pointed out, where maybe we're losing good people for a variety of reasons, areas where we have high turnover, places where we have a hard time attracting people, so retaining them is really important, like our nursing staff at the health center or the corrections, deputy sheriffs, whatever we have set before us. And so I'm very excited about the opportunity to be able to use a platform like Qualtrics. In the demo that they did, it's very dynamic, and we can even push the results down to each department level so that they can see the information. And so there's a lot of flexibility. It's really robust, so pretty excited.
The one thing back on the citizen engagement piece was the ability to, as elected officials, so say that there's an issue on public safety, we would be able to tag that for the sheriff. If there was an issue, whatever issue it is, we can drill it down to our districts, know how many responded, know what the responded, was it good or bad or whatever. And that to me is valuable, especially as we're moving forward with some policy decisions. You know, the more information or the more input, and we've always struggled with how do you get that input from your citizens. And this would definitely be one way to do that, and again, drill down to help us in our district to find out what those important issues are.
Yeah, I agree, and even across the scope of the departments we haven't drilled down yet too, this is an all-encompassing product that can bring them into the fold too when they're ready. I work with the Utah County clerk and auditor, and they are doing performance audits on the system. Utah County is also moving to an all vote by mail process, and so they are collecting input from the voters who are submitting their mail-in ballots to ask them about how they could improve the form, the layout, the questions, the concerns, to improve the vote by mail-in process. I work with a number of assessors departments to help with appraisal feedback, to help with statistical modeling for property evaluations. We work with planning departments on a number of different issues, economic development, airports. We help with airport. We help with tourism. You guys have great facilities here, convention, ballpark. I mean, how do you market it better? So not only are we very tangible on the first steps, but there's so much more that will come into the fold over time that provides valuable data for each department and the actions that are here. I'm going to wrap up with a few ROI evaluation slides, and then try to wrap up the day soon here. Qualtrics just had independent evaluation conducted on us by Forrester Research. We have a 674% return on investment. The first category is the reduced costs on staff. This really comes in when you look at inefficiencies, whether it's a 311 program, whether it's pinging back and forth between departments, really making sure that the staff you have are focused on the right priorities and making them more efficient in their daily job offloading different burdens that may be slowing them down and making things more tangible. The next category they found of ROI was cost savings. We see this time and time again. There'll be a tool here and a tool there and a tool there and a tool here and a tool there and on and on and on. Consolidating those costs saves a lot of money. Making better data-driven decisions, as you said, Commissioner, really understanding policy at a deeper level can help you make better decisions rather than just being pushed by some loud group. Slowing down, recognizing where consensus is can make smarter policy decisions. I mean, I was a congressional staffer in DC and we always made data-driven decisions. And the final one is decreased costs of customer support. And this can break down into topics that are more attrition related or retention, right? Because if you have to keep training new staff to deliver the same service, that costs a lot of money. This can also have to do with the actual frontline staff that's providing service. And I'll give you a great example. Chicago Public Utilities uses us, and they wanted to understand their bill, just their standard utility bill to the Chicago Power Company customers. And they sent out the bill, put a link on it, said take a Qualtrics survey, text it in, go to this link. What came back was that they had line itemed out their bill so much that it created more questions than answers by the time they were at the total, like $129 for what category of cost? What they did is they ended up double printing the bill, so it had the total on the front page when you open it in the mail, and it had the line item on back. It reduced their customer support call center man hours by 30%. It saved them millions of dollars from just changing one little thing on their bill. So none of this is like pie in the sky, like, ethereal results. It's very tangible. If you understand the process, you can improve the process and save money. And they saw a payback period of less than 6 months for our customers and a total lifetime value of over $1 million for all of these benefits. On the employee engagement side, and it's no secret, but we have a lot of great data here on our one-pager that, companies with engaged employees outperform those by 202%. The number of sick days of an engaged employee goes from a 6.19 from an unengaged employee to 2.69 a year for an engaged employee. I mean, those results in and of themselves really enhance the ROI and the net income. Down here, when you look at your insurance, workers' comp, whatever you guys have, engaged employees are 48% safer, have 41% less accidents, and 41% lower healthcare costs. So the tangible ROI of this is very much right in front of us. And to augment this external data, this is our own internal data this is our average customers of Qualtrics. We see a 45% increase in productivity. If you have 100 fires to put out versus 10 strategic ones, you can be more productive. It increases research speed. You have a tool in your own hands, data at the power of your fingertips. You can make it happen. You don't have to go consult with people. You don't have to go do some study. You can just simply go straight to the source and research the issue. And then ultimately increasing customer engagement. The Provo mayor started out 8 years ago with a vision to make Provo and Utah County what they call Silicon Slopes now. We now have Adobe, we have Ancestry, we have EMC, which got bought by Dell Computers, we have Qualtrics. We have $3 billion companies in Utah County now that were not there 5 years ago because they wanted to make it a business-friendly place, a family-friendly place, and they wanted to enable business growth, but they wanted to market it. They wanted customers, residents, businesses to feel engaged in the community. And that's why he has such high approval ratings, and he's going to win his congressional race by 35% tonight. So this is kind of really all the bottom line difference in the ROI and the platform. And I do have a proposal slide as well. I don't know if you want us to get into that as well. Any questions so far on the use cases, the research, the ROI, before we go to the real bottom line?
Well, I think the only other point I would make, and we haven't done this, but we probably could, is at some point in time, I would bet every office, not every, but the majority of offices have done some type of data collection and then paid somebody to do that and paid somebody to analyze it. And so the piece that I like about this is that it, you know, no matter what the issue is, we would be able to create it or establish it to fit, you know, what our county attorney wanted to do, what our sheriff wants to do, instead of having to go out and spend more
Yep. It's just like
on a
JetBlue.
variety of products. So.
And actually, all of the end consultants that you probably have ever worked with actually use Qualtrics. Gallup is a big customer of ours, Union Pacific, I mean, you name it.
Well, our university, who we use.
Yep, exactly. So it saves a ton of money to not go through middlemen, essentially, as well. So the last slide is to really talk about the package for the enterprise. And because of the efforts with Luck and our CEO graciously offered our entire project half price to Douglas County and others, because we really support our public sector and we want to be great corporate partners. So the price for an enterprise-wide account is a $125,000 annual license for everything included, plus the use cases, employees, departments that will come into the fold. There's always a technology cycle of early adopters, medium, and laggards, and that's okay because this platform covers everyone. There's a one-time implementation cost of $20,000 that includes the consulting, the IO psychologists, and product professional services engineers to make the implementation and training happen. We do all of the heavy lifting, and our team really understands government. I mean, this is not a you buy it, put it on the shelf, forget it kind of product. Connor and I are hands-on with all of our accounts. They're growing. And we offer the best wraparound support. There's 24/7 live customer support in our Provo office. The commissioner saw them on the second floor. They're all kind of like, if anyone's watched The Big Bang Theory, kind of our lovable nerds and slippers and hoodies and all kinds of crazy stuff. But you have access to them all the time. And it's not just technical support. You call in when it's broken. They're mini consultants. They have MBAs from Yale. They have IT degrees from Brown. They're some of the top talent in the world is coming to Qualtrics right now to join the rocket ship of a company we're on. But this includes unlimited data, unlimited users. It includes all the features, the offline app. We brand the theme for you, so the sheriff's department can have the emblem and logo and seal of the sheriff's badge on it. Corrections, HR, I mean, your logos matter. You guys have brands to represent, not just in the community, but to your employees. I mean, it means something. And that's another reason why organizations are bringing Qualtrics in-house, is it's not about a third-party consultant studying it. It's about you understanding the issues, getting your hands dirty, and saying, we want to make corrections a better place to work. We want to make it proud to work there. We want to, you know, really make sure we do right by our customers, our residents, our staff. Text messaging is included, advanced text analytics, so you never have to read every response, it does it for you. Reporting and crosstabs, statistics, the panel management, division and user configuration. What we do is we'll configure it so the commission is a division inside the account, each department is a division within the account, and the department head or their designee will be what's called a brand administrator to grant access and rights to the staff they want dedicated to the account. All pretty easy to set up, takes a matter of minutes. Obviously all the employee engagement, exit surveying, and then the implementation's great. We have live trainings, you get to know Connor and I more, we try to be funny and do some stand-up comedy here and there. We have webinar trainings, we have a tutorial website, so it's something that's all very much out of the box, ready to go. We hit the ground running. We do most of the heavy lifting, and I will tell you that from rural county commissioners in kind of what we call the middle of nowhere, Utah, I've taught them how to use this product on their own. I mean, they don't have staff and professional staffs like here. They are the staff in some of our rural customers, like some of your rural counties here in the state. You know, there's a couple thousand people in a county. So the product itself takes about 2 to 3 hours to get dangerous on. It's not a heavy lift. I mean, we're a $1 billion tech company. We designed this to be user-friendly. This has been tested by hundreds of counties before you, NACO approved, and something that I think for this price point, if we help retain just a couple more employees, if we help make a couple more processes efficient, it pays for itself. I mean, I don't think even getting near the ROI is going to be difficult for this product, let alone how much further we can accelerate it. And that's why you saw that independent evaluation shows about $1 million ROI. And that's on the conservative end. We help retain employees, we help build the brand of the county, we help attract companies, workers, residents, we build a better quality of life, and if we help solve a couple small problems like Chicago Public Utilities along the way, we save some staff time, some staff money, we keep staff around. So this is all something that's very much ready to hit the ground running. We're doing this all over the country right now. We're going to be in Sarpy. I know Dan's excited. Lancaster just purchased. Going back out to Arizona for counties out there, Santa Fe County, Donna Ana County, New Mexico. So this is kind of very much happening all across the country right now. So, you know, any questions now? That's kind of the last bit of slides I have. I know you'll probably have maybe some reactions to this or other things in the presentation.
Any questions or comments on it? Feel for good, bad, indifferent? Go for it, don't go for it?
What kind of ad hoc reporting capabilities does it have out of there?
Yeah, that's a great question. So we have all kinds of reporting capabilities. I'm going to jump into the technology here to show you around. So this is, I'm going to pull this up. So it's just a web-based login, so we just assign usernames and access privileges to this, and the interfaces look a little bit different for employees versus customers, but it's the same platform. So first I'm going to jump into dashboarding, because I think the dashboarding is one thing that's really important to look at of how you create ad hoc. And I apologize, this is we got a Utah seal here, but it will look very much similar to what you guys are doing here. So this is where we break it down at the top left by district, right? So we'll have district, 1, 2, 3, 4, 5, 6 for the commissioners here. If we jump over, let's see if I can narrow that. Let's see. If we jump over here into this summary page, this is where we can track all the interactions by different departments, libraries, motor vehicle, health. Obviously these are a little bit different for your county, but we can track those. And then what's really interesting is we can really understand our panel and our feedback over time and in real time. So I mean, this updates on the second as data comes in. And let's say I want to filter for my millennials. I want to click 18 to 24-year-olds. That's going to filter all the criteria in real time. And the constituent issues in Utah are a little bit different. Liquor law reform, big deal in Utah. Air quality, we're actually in a bowl surrounded by mountains, so we have terrible, terrible air quality, one of the worst in the nation. And we actually just got the Medicaid waiver approved yesterday from the federal government, so we're actually implementing Medicaid expansion for 8,000 new people. But, let's say we want to drill into our ethnicities here. We want to check in on a particular ethnicity. We can see how all the variables change in relation to that data. What our industries are, what our household incomes are, what our issues are. We can see constituent satisfaction trends over time. We can see business satisfaction. We can see household types, household sizes. And so we can really look at our constituent and civic engagement. But then let's say we want to drill down to a particular department. So I don't have a corrections or a sheriff's on here. But yeah, we can do public health. So we can track those interactions over time, email, office visit, phone call. We can track, supporters and promoters. This is a benchmark scale that we use to identify, bad experience, good experience, but simple, right? Green is good, red's bad, yellow's caution. So we can understand, how they're doing, and we can even do it in, relation to what type of contact type do they have. So if we go over here into the details, we can understand for our public health, how we can actually see, were you satisfied your question was addressed or concerned? Did staff treat you with respect? Do they have a helpful attitude? How are things looking? And, in this example, it looks like, in February 2016, communication and respect were lower than average. So red is bad, cautionary, green is good. So we want to make sure we get these scores back up, but then we can actually scroll down here and find out, what's going on. So this person said this was a really painful process to conduct over email. And we can come in here and we can actually automatically or manually create a ticket. So, we can come over here and say, help this resident with this health form. And I'm going to assign it to Connor over there. He's going to go take care of it. I'm going to assign it high priority and say, please follow up with this resident. And so I can actually create and assign this ticket in real time. And this was done automatically. So this is what Miami-Dade's doing, where they actually just did a tree mapping sequence where they said, if this happens, then notify this person. So you can manually assign a ticket just like I did, but it will also automatically route complaints and issues to the right personnel. Then we can go over here and we can actually look into this closed loop ticketing and say, okay, my target is less than 5 open tickets. I'm at 6, so I'm in the red, and it looks like I haven't been resolving them very long. So I can actually scroll into here and say, attempted contact, contact with the resident. And I can assign that, a first status and a first priority. And so all of these reports can very much be pulled down, downloaded, and kind of integrated. And then I'm actually going to jump into how do you actually produce the forms, produce the data, produce the content. So this is what we call the research core area. So this is where you put forms together. And like I said, we'll brand these for all of you. So this was a fun, this was real data. The State of Utah Library Division did a survey of all employees in the state on library card holder status. We have 75 languages natively integrated into the platform. So we can translate every question, every form into Spanish automatically. Vietnamese. We have 75 different languages that the resident, the employee, can actually translate those to on their own. And then when it comes to the reporting, we have all kinds of ad hoc reports here. So we have all kinds of charts and graphs you can make. Do you have a public library card? We have this broken out by degrees. Purple was no, red was yes. I don't know why they picked those colors, but we could easily change those right here. I could reverse the color palette. I could, whatever we want. These are all ad hoc reports. I could make a pie chart. I can make a breakdown bar. And then my favorite thing is that you can share these. You can come in here, create an ad hoc report, and then you could put it on Facebook and then drive more engagement. So this is actually creating a public link where if Leah or your staff's copy and pasted this link to your website or to a social media outlet, boom, the public can now see my input mattered. Here, I'm one of those people in there. I said yes, and I have a college degree. And this is called closing the loop. Like psychologically, there's a positive effect when you hear from the resident and they hear back from you. It doesn't mean you need to say, wow, we fixed all your problems and here's what we're going to do about it, but it's like, thanks for sharing, here's the results. I mean, how many of us during presidential elections or congressional get polled every single night and you never know what poll you were a part of or where it was going? Here you can connect back to those residents themselves. So it's a really easy process to create all the ad hoc reports you need. What library services do you use? We have research, checking out books, entertainment. So there's a lot of different applications for kind of really understanding this data here. Yeah, I know.
I'm just gonna tell you, 4:30 is like the.
Okay.
Yeah.
So we're getting antsy.
We're
Get
getting
out
close.
of school.
People are getting a little.
So anything else?
Yeah, is
question-wise?
there any ongoing annual maintenance costs?
Nope, they're included in the annual license fee. So it's a one fee per year for everything: support, technology, account management, maintenance, upkeep, everything.
If you need to use the IO folks, is there an additional charge for that?
Good question. So we have 35 PhDs on staff. If you need additional consulting and professional services, we have an hourly fee. We can quote that out on a project-by-project basis if you need a little extra horsepower on a project. Usually ranges about $250 an hour to $500 an hour, depending on the project.
And how often are those needed? Depending on, I suppose it depends on the project.
Depends on the project. I would say relatively low. One of the great things is we create a library for you so everyone can use the same content and it doesn't have to be recreated over and over and over again. All staff will have access to the Douglas County Library of Templates.
Oh.
So that was really effective. So, you know, if you have an employee survey, you want to pull it down and do a quick follow-up on it, you just pull it down and send it as a follow-up. So it's you know, football, we're all in one playbook here. And so we all learn the playbook, we all use the playbook, it gets very easy.
What?
I said not the NFL.
Oh.
Yeah, not that playbook.
So, any further questions or comments on the presentation? I'm real excited about the opportunity to see if we can try to figure out and garner the support to move forward with this. I think, again, our return on investment would be quick, and the data that we would be able to get and use in making good decisions is absolutely priceless, in my opinion. So, what I will do is work with them to solidify a better proposal and for the board to react to, and then I'll bring it to the board. And then if you guys have any additional input between now and then, in the next couple of weeks, just let me know. But, okay, so let me ask you something. If it was, so we highlighted the departments in which showed an interest from the first presentation, but say, so after this, we do a proposal and say we go for the whole kit and caboodle. That would allow then other offices to...
That's one price countywide, okay. No additional fees to bring on new departments.
And
that's
it was...
John said he would have paid for it out of his budget.
Was it?
Yeah, right, yeah. Just kidding, actually it's double the money for county attorney's office.
Is the $125,000, is it half off that, or is the $125,000
that is the
I just wanted to clarify.
Is that just for the first year?
Ongoing, per year.
Per year.
For how long?
Forever.
For a long time. Indefinite.
All right, sounds good.
And I will tell you from being there and not only listening to their CEO at the panel discussion, but when we were actually at the headquarters, he is very, very excited to continue to engage counties. And again, being one of the largest counties in Nebraska, I think this would be a good place to start and show leadership across the state of Nebraska of what we can do with Qualtrics. So anyway, I'm excited about it. We'll continue to work and see what we
definitely.
can.
Sounds good. Thank you all so much for your time. Appreciate it.